Hi, I'm Brennan. I use he, him pronouns, and I was looking at STI testing in trans participants. So I actually started off as a work study student with the investigators, but I feel like I really got kind of adopted and I got to do a little bit of analysis as well. So my question was, did trans participants get tested for STIs as recently as cisgender participants? So part of the reason why I was asking this question is because I'm trans, and I've accessed STI testing services or really just generally accessing healthcare. I know that oftentimes there are a lot of sort of touch points where you're talking to different people throughout the process. So you might be talking to a receptionist and then maybe a nurse and then maybe a doctor. And what I was thinking about is sort of at every point during that process, say if your legal name isn't changed, there's possibilities for someone to misgender you or use your birth name, which can be a really uncomfortable experience for trans people. And then there's the complexities of STI testing in general. Like it's not a fun, comfy experience for a lot of people. And I think especially for a lot of trans people, sort of not knowing potentially if your healthcare provider is trans friendly, or if you're going to have to explain things to them, or if you're going to be questioned as to why a certain test was ordered. So I think that there can often be a lot of stresses in terms of just accessing these services in the first place, or at least that's been my experience. And that was something that when I was looking at the literature, I also found was a pretty common experience. So some studies found that trans people were more likely to experience barriers in accessing healthcare. And sometimes this was due to previous negative experiences. And then sometimes people would avoid routine care or even visits to the emergency department because of this anticipated stigma. And then in terms of specifically STI testing, and specifically in trans, gay, bi, queer guys, people experienced sometimes just ignorance on the part of healthcare providers and received misinformation, were misgendered or called by the wrong name. And this was found even in clinics that cater towards the gay community, that just sometimes apparently don't have trans competency. So these were the two questions that I looked at. So the first was, do you have trans experience? This was a yes or no question. And of those who said that they had trans experience, around 70% listed their gender identity as man. So this other 30% could be anything from transmasculine or trans man, or it could be something like genderqueer or non-binary. I didn't have access to the write-in data for my purposes, but I know that there was quite a variety there. And the other question I was looking at was when were you last tested for any STIs? So that question, I divided up into two categories to look at. So those who were tested within the last year, and those who were tested longer than a year ago, had never been tested, or didn't know or didn't remember the last time they were tested. So as you can see, cisgender participants were significantly more likely to have been tested in the last year. So 71.7% versus 65.2% of trans participants. And then I did a couple of other analyses with some similar variables. So the cisgender respondents were also significantly more likely to report not having delayed or skipped testing in the last year for any reason. And then when I was looking at sort of the particular reasons, trans respondents were over 3 times more likely to report having delayed or skipped testing in the past year due to lack of professional sensitivity to gay, bi, or queer men's health. So that was the precise wording of the reasoning in the box to tick. So I interpreted that as probably people were experiencing maybe some transphobia if it was very significantly different from what cisgender men were experiencing in accessing testing services. And yeah, so I think in general, I think there needs to be some more research into the experiences of trans people accessing STI testing, or why people aren't accessing it, and maybe some more qualitative research into that, and really looking at the lived experiences of those people. And I think also in general, steps need to be taken to make it an easier process for people, to make it more accessible. And I think there's been some interesting initiatives in BC and now in Ontario with home testing. But even with the sort of structure that we have now, making sure that there's options for, or not only options for a preferred name and preferred pronouns, but that those options, when they're listed, are actually followed. And people aren't reading out from the wrong sections, and just some general training in trans competency. So yeah, that's my presentation.